So, the telecardiology, telehealth and the 5G technology. So, now telehealth, telemedicine has become very prominent, especially after COVID pandemic. Though it is there for the past 12-15 years in the globe, it is not really accepted by majority of our medical fraternity and also by patient population, because everybody felt that the physical presence of the patient is necessary to make a proper diagnosis, to establish a rapport and to better communicate with the patient with regard to the diagnosis or management. But now we know 80% of the diagnosis, 80% of the times the diagnosis can be made without touching the patient. Now the stethoscope and clinical examination, which all of us were doing, is replaced by imaging and the laboratory investigations, wherein there is a rapid diagnosis within 1 to 2 hours. Any type of disease can be diagnosed, almost 90 to 95% of the diseases can be diagnosed within a few hours. Whereas, if you apply the clinical skills and without all these ancillary investigations, we were taking a few days time. Sometimes that delay could result in lot of damage to the patient, delay in diagnosis. Now, all over the world, system demonstrator and North Yorkshire County Council studies, even by 2015, they have shown that unnecessary admissions, especially the ER admissions, emergency room admissions, can be cut down if telemedicine can be utilized appropriately, especially when in the remote places or mandals or villages where the people do not know whether the complaint they have is critical or not. So, telemedicine helps unnecessary travel, unnecessary admissions, and at the same time diseases which are dangerous like mild chest pain, which could be a serious heart attack, is missed often because it is mild and the patients come late, almost take 10-12 hours, or they do not come till the next day, by which time most of the damage is done. So, identification of the disease and advising necessary admissions and avoiding unnecessary admissions is now very well proven, and it is much more proven in the COVID era. Now, after the COVID era, almost 80% of the doctors and more than 50% of the population now are accepting this telemedicine as one important mode of getting treatment or diagnosis from the doctor.